Good morning, everybody. Sitting here waiting for my car to defrost. See the ice over here. Yeah. See outside. We'll let it defrost a little bit. Give me a chance to talk. Check in. Today is Tuesday. Second opinion doctor, see what he says about clinical trials or anything different that we can do that we're not already doing. I don't know what else to say. Otherwise, I feel like crap. I sleep all night. My body hurts so bad. It wasn't anything to me, but I went to just push it, and I didn't feel anything. Okay, I was real careful. Thought it was fine, and man, my chest, all over here, like my ribs. I got a cracked rib or something, and then the back pain, which just, man, wraps around the side all the way to the back on the bottom. It's just so uncomfortable. Mess. Not really, but it sucks. It sucks. Seems like every day. Pain. Or the old ones just creep back up. I thought they were gone. And, man. Why? I don't get it. Alright, time to fight the cars out of the driveway. I guess. Fly around that corner. I'm a little pissed. And, well, they don't stop. I'm trying to get out of my driveway. No problems today. Oh, the sun is shining. Great. Holy cow. Where's my glasses? Go to work for half a day, and then at noon I'm going to go see the new doctor, see what he has to say, and we'll go from there. Hopefully I can record while I'm in there. I don't know. I'll try it. I'll probably just set the phone down and just record that way. That way I have a record. We can listen to it again and see what he really said instead of getting it all. It's like I got a couple broken ribs or something. It just won't heal. This is from 2 months ago. Something I thought about last night was did a swan dive right straight into the ground. I wonder if that's not when I did this chest thing. Because, man, I don't know. I was hurting then, that's for sure. Anyway, up. Keep chugging along. Take this one day at a time. I'm doing a lot of research on food groups. Switched to my tea. I told you that yesterday. caffeine. Make sure of that. I'll check in at the new doctor. See ya. All right. Yeah, we're in the room waiting. There's Gretty. She doesn't really want to be on camera, so I'll take the camera. See me? Yeah. I should look at that left eye in this video when I get done because it's bugging me. We're waiting for the doctor at Siteman Cancer Center. Second opinion visit, see what he has to say and check this lump on my head. I don't know.
See if there are any trials you qualify for.
Oh, that's right. I may just leave this on and you can just hold this.
So how you doing?
Okay.
Okay, so I heard you're having a bit headaches, is that right?
Mm-hmm.
When did this start?
When it was 29th, so it was the 30th.
Okay, so it's been like for about like a week now.
Yeah,
or
it's
so.
just a slight headache.
Okay.
The
Yeah.
blurriness started on third. The headache was there before.
Mm-hmm.
Just a slight headache.
Mm-hmm.
It just won't go away.
I see.
And now blurriness in my eye. I don't know if they're related or not.
Okay. And you have numbness, my understanding?
Yep, and my leg right here
Okay.
goes down to about here
Mm-hmm.
and comes all the way up to about here.
I see. Okay. Any back pain?
Yes.
Okay, where?
Right in the lower back, all the way across the back. And then some up in the midsection.
Uh-huh.
I felt that this morning.
Mm-hmm.
I mean, I didn't sleep very good because of that, and the just the pain in my chest.
I see.
Having trouble. I did something again. I don't know what I did to my chest, but I think I aggravated it.
Okay. Any issues with your bowels or urine?
No.
No, like no.
We're good there.
Okay. No, you're not soiling.
She's jealous.
Okay. So you're not soiling your underwear. You're not wearing your underwear. None of that. Okay.
No.
Okay. And the reason why I'm asking you, because I'm a bit concerned with this numbness and tingling and back pain. So sometimes you might have tumor there, and that what could cause this, so like what we call it is spinal cord compression, where you have tumor on the spine and pushing on the your spinal bone and pushing on your spine itself. So I'm kind of a bit concerned about this, with this tingling, numbness and back pain, especially something new on you. And
the back pain's been with me for a long time.
Long time. It's not
it's
anything that
chronic. I mean,
chronic.
it's just gotten very severe when I couldn't walk for a week and a half. That's the first time that ever happened.
And that was when?
A month ago, maybe, was it?
He threw his back out, yeah.
Yeah, I mean, they took X-rays and.
Did they do any MRI of your back?
I don't think they did. I just had a CT scan.
Yeah, so CT usually not very good for this,
Oh,
It
okay.
improve with steroids.
Yeah.
Give you steroids.
Yeah.
Yeah.
And they put on steroids and improve. Yeah. Yeah. Okay. So, so again, we would want to treat you, but I just want to know exactly where you want to be treated, because that really, dictate how I'm gonna approach you with the scans, all that stuff. I'm happy on your case. Also, if you want to switch care here, I'm more than happy also to take care of you. I mean, we tell you, what I feel probably we're a bit more in rush to get scans on you. I mean, one way actually to get them all, in my opinion, quick, is to get you to the hospital. Then we can get everything we need, because I'm concerned about this back pain and this tingling numbness in your leg, Especially, right. Julia told me you start to have something on the skin.
Yeah, I got a lump right here that
yeah.
feels like the one that started on the back of my neck.
Yeah, and the headache also concerns me as well, because melanoma has tendency to go to the brain as well, So I feel like we're kind of like, you know, in rush, like I want to get all these scans, you know, to understand exactly what the disease volume is in your case, you know, before we decide what we need to do in treatment. Like in big picture, I want to definitely put you on immunotherapy. I know you have received Optivo, but I want to combine it with another agent. That's the, you know, easy answer, you know, but is it the right time for you right now? Because if we see a lot of things, I think what we need to do first to do volume reduction of the tumor, and I know you did not tolerate well the brafenib and trametinib, right? Or
It was the
Tafinlar
Tafinlar.
yeah, this is the same thing.
Okay.
Yeah, so brand and generic name. So I think if, let me tell you the two scenarios. If we do scan and I see very low tumor volume in the brain or in the spine, I would do this combination of Optivo and Yervoy, the immunotherapy. If I see larger volume of the disease in the brain, you know, and your spine, so we might get radiation oncology on board, but also what I would do first, before I do any Optivo and Yervoy, I would do a targeted treatment similar to Tafinlar and Mekinist, but it's different drug, it's the same class, different drug called Mektovi and Braftovi. So the reason, I know you did not tolerate very well, but I can, you know, those are like same class, but you know, some patients might not react very favorably on one drug, but they react better on the other one.
Yeah, it attacked my eye.
I understand. I mean, when we repeat the other thing, we could have the same thing. But if I have a larger volume of disease, I think that's what I would do. I would do still target treatment, and the reason why, because targeted treatment work faster. It does not have that durability of controlling the disease like immunotherapy, but it can achieve that tumor shrinkage faster. So if I feel like I need really to reduce the volume of your disease quickly, I would still do the targeted treatment, but I would do it like for a couple months or so. I would not leave you on it till you progress on it, but rather just very short course. And then I do what we call it planned switching. I would switch to immunotherapy.
Okay.
So again, your case in my, you know, I mean, I don't have all the ins and outs, you know, in terms of imaging, all that stuff. So I still cannot say confidently what I would approach you with. I told you the simple answer to the question. If you did not have the other issues, I would say Ipinivo or Yervoy Optivo, same thing, you know. But if we see something different on your scans, you know, then my approach would be different on how what I would do.
Okay.
So if you want to think about, you know, where you want to be treated, all that stuff, you know, I mean, you don't have to commit right now.
Is there a difference in quality as to where I get treated?
You know, quality, I don't know. I mean, to be honest with you, I mean,
would I get the same treatment at, say, Lake St. Louis's versus
yes,
Siteman here?
Yes, you'll get the same treatment. The decision making, you know, it could be different sometimes between physicians. So this is a different, you know, we might be on the same page sometimes, or most of the time, and some other times we might not be on the same page, me and your other physician, you know.
No, you
So
work
that's
together?
I mean, I can work with him. If you want to be treated with him, I can, you know, send my note to him and, you know, tell him this is what I think, you know.
Well, he kind of sent me to you because he trusts your experience with the melanoma.
Sure. I mean,
so I would lean to being treated by you.
Sure. I mean, I would be more than happy again. So I don't know exactly why you're here. So that's why I'm asking you how you want me to help you. You know. So we're happy to take care of you. I mean, if I want to take care of you today, quite honestly, I want to get things done fast. So if we want to get it fast, I think best thing is to get you admitted to the hospital. And we'll try to get things moving. So because in the hospital, I'm going to do brain and spinal MRI. I'm going to do MRI. While in the hospital, probably we'll try to get PET CT scan again. And we'll take from there. And based on what I see on the results, you know, I can communicate with the inpatient team what we should do. I mean, if things looking good, we'll tell them, you know, get him out. We'll see you next week.
Okay.
If things needs, you know, some other intervention because there's impending, you know, tumor pushing on your spine and we need to get other services, we get radiation oncology, we could get surgeon. It depends what we see. But I feel like if what you're telling me with this headache, with this tingling numbness, I get concerned about, you know.
Okay.
Okay.
Well, I think we need to I feel that we need to act fast because I'm not feeling too good.
Yeah, I agree, you know, so, I mean, so we can work, but, you know, if I wanna admit you, I'm gonna admit you downtown, at the Barn Jewish on Kings Highway,
Okay,
the Simon over there.
okay.
Yeah.
Now, how long would I be in there?
It depends on what we find, but minimum, I would say a couple of days, because till we get all these scans, you know, the MRI, let's say everything looks okay, not concerning, we don't need any immediate intervention on you,
Mhm.
probably a couple of days. If we see something, could take longer, it depends on what we see.
Okay.
And are you
And-
talking about getting him admitted today?
I would say so, you know, if you want to, you know.
hmm What do you want to do?
It's up to you. I want
You
you
got
to
to drive me down there.
I want you to have the best.
Yeah, I mean, first,
Fair.
might not be right now, you know, so we wanna make sure we have a
Do
base.
they
because-
validate parking?
Oh,
Yeah.
gosh, John.
Yeah, they do.
I mean, I can drive down myself.
No, they do, you know, but it's not, you're not gonna go right now, so it might take, like, might tell you go at 6 or 8 p.m.
Right,
So
yeah.
it depends, we wanna make sure we
Right.
have, because it's gonna be direct admission, so you won't be in
Okay.
the ER. So we'll see what the bed availability, you know, if we have one, right now, we'll tell you just drive down there, if not, it might be, you know, later today.
Is she allowed in there or not?
She is,
She
yeah.
is allowed,
Yeah.
okay.
Okay.
Yeah, I think they allow one person now. Yeah,
Yeah.
so it should be allowed.
Okay.
So if he decides to do all of this and go with that, that's a trial you're talking about with
No.
the two. Oh, it's not a trial.
So I mean, I think if he has brain tumors, you know, we don't have a trial for you. We don't. But regardless, you know, I mean, I think now the standard of care, in my opinion, or what is FDA approved right now for you, is better any trial in my mind at this point, because we still did not receive that Yervoy. I think Aptivo Yervoy probably has potential to work on you more than a trial. You know, if you
Okay.
failed that one and things looking good on the brain, we could consider you. But you know, I mean, again, right now, I think the chances we can put you on a trial is still very slim as well.
Okay.
So with this treatment that you're suggesting, how effective has this been?
About 30%, the combination. Usually for patients who did not see prior treatment like Optivo, it's about 50%, but patients who failed Optivo, probably about 30%. And that would be depending, you know, I'm talking about patients who don't have a brain involvement.
Mhm.
Patient brain involvement, it depends on the size, you know, if those are micro tiny things in the brain, probably still about 25-30%. If we have more larger lesions, so then it might drop as well. We don't have data about this one. We don't know, but you know, I mean, from our expertise, probably lower. You know, I mean, there's still hope. You know, I'm not gonna cut hope. I will tell you. You know, I mean, this now I'm working as like with the standard option.
Mhm.
Like if we fail standard option, you know, and your body can cooperate with me, you know, we could come with outside the box option for you.
Okay.
But you know, we'll take a step at a time here.
Well, let's get the scans done. That's the first thing
Yeah,
I need
yeah.
to do.
Mhm.
Okay.
Go from there.
Let me go get Heather.
Highway, it's
Okay.
the North Tower, it's called the, now the Forest Park Building or something, it's the new one, so we'll give you direction there.
Okay.
Yeah.
That's a big complex now.
Yeah, it is actually, it
Huge.
is. It is.
Wow.
Yeah, I mean, the easiest way, I think, if you wanna park, you park on the, like, lead, station or
Mhm.
parking lot, you know. So this
Okay.
is like Kings Highway and there's a street called Leclerc. I don't
Yeah,
know if you're familiar with that, yeah. So that one is easy because you can walk the bridge and then you go right into the hospital where you need to
Okay.
be.
Okay.
Okay.
Oh
It's,
yeah. Right here.
Okay. All right, hold on one sec, okay?
Okay.